So one of the best ways to explain aortic stenosis, the condition, is that inside your heart, you have four heart valves which guide the flow of blood through the right chambers of the heart. And one of those heart valves is called the aortic valve. And it's the valve that guides the flow from the main pumping chamber of the heart out to the body. And you can imagine these heart valves work extremely hard during your lifetime. They open and close 70 or 80 times a minute, every minute of the hour, every hour of the day, every day of your life. So many times they open and close. And so therefore, it's not surprising that at some point they get worn out. And aortic stenosis is a condition where this heart valve becomes worn out such that it doesn't open fully, and often it doesn't close properly either. And as a result, if it doesn't open very well, it can lead to obstruction of the flow coming out of the heart. And if it doesn't close 100% well, it can lead to leaking of blood back into the chamber of the heart. And people with this condition can have various severities of how worn out that heart valve is. And they can often have symptoms in association with that abnormality, which commonly include breathlessness on exertion, but that can also include chest discomfort, dizzy spells, and sometimes, blacking out. Symptoms like that can be associated with this condition. But one thing we do know is that often this condition will be there in the background for many years. In fact, it's often taken many years to get to a stage where it becomes significant, what we call clinically significant. And it's appreciated that once symptoms actually start to arise in connection with this condition, then that means that the aortic stenosis has probably reached quite a severe point in how badly affected that valve function is. So it's important to appreciate that when patients present with symptoms that include breathlessness and dizziness or even chest pain, that the doctor examines them, because often they will find a murmur. And in anyone who has a murmur on listening to the heart, who are presenting with appropriate symptoms, the doctor should always be alerted to that possibility. Aortic stenosis has different grading on how worn out the heart valve is. We commonly refer to it as mildly affected, moderately affected, or severely affected. And as these terms are quite self-explanatory, the severe is when the valve has got to the stage where often symptoms will be, the patient will be reporting symptoms. And at that stage, when the valve has been severely affected, in other words, severely worn out, that condition would mean that if intervention was not considered, then the valve is only going to progress beyond that point, and then it can lead to what we call adverse outcomes, or it can lead to events which are quite significant, such as blacking out or the heart and circulation becoming more under strain. So when it gets to severe, then the patient needs to be properly investigated to see what treatment options are available. This is a very good question. Traditionally, 50 years ago, if you had severe aortic stenosis with or without associated symptoms, then the only treatment option available to you was open heart surgery, because it's a mechanical problem. So tablets, although they can make the symptoms, they can sometimes help with symptoms like breathlessness, tablets will not reverse the heart valve being worn out, because that's a mechanical problem. So therefore, it needs to be resolved with a replacement of the valve. And many years ago, that could only have been done by means of a valve replacement, which required an open heart operation. Now, you can imagine that in people who are, in their 80s or 90s, undergoing open heart surgery is quite a major undertaking. And not all patients would be deemed suitable or be able to withstand that type of major surgery. But the revolution that's happened in the last 10, 20 years is that a procedure has become available called a TAVI, transaortic valve implantation. And this has allowed us to replace the valve by much less invasive means, so that it's opened the door to make this an option for patients who otherwise may be deemed higher risk to undergo major cardiac surgery. So that's why it's very important to for doctors and clinicians to be aware of the condition of aortic stenosis when they see their patients and examine them, but equally important to make the diagnosis accurately, because the door has been flung wide open with more patients being amenable to corrective treatment of this serious condition. So the treatments are so patients need to be diagnosed correctly, and the way that the condition is diagnosed is that the first line test is known as echocardiography. So this is a cardiac ultrasound scan, which is very simply done at the patient's bedside with a machine and appropriate expertise. It uses cardiac ultrasound to visualize the heart valve and to make measurements, and that is how that is the first line diagnostic test to evaluate and to diagnose aortic stenosis. Once a diagnosis has been clarified, then patients will need what is known as a workup, which will include often evaluation of their coronary arteries to make sure that they don't also have coronary artery disease. And other patients may need assessment of their lung function if they're known to have lung disease, but they'll need a number of tests in the workup to a review of their case, usually in a multidisciplinary environment where there are doctors, experts in imaging, there are surgeons, as well as these TAVI implanting doctors. And the decision is made, first of all, that the condition is confirmed as severe. The second decision is made that it is appropriate to intervene on that patient, given all their clinical details and background details. And the third decision is what mode of aortic valve replacement is most appropriate in that particular patient. So in some patients, they may actually be put forward to the more traditional open heart surgery, surgical valve replacement, but other patients may be deemed more suitable to undergo this less invasive TAVI implantation. And TAVI, obviously, when it first came out, like most kind of technological major advances in medicine, and in particular in cardiology, there had to be a certain period of time where cardiologists were confident that this procedure had good long-term outcomes. So when the implant went in, patients were observed for many years to make sure that the implantation was intact and that it wasn't associated with any major medium to long-term outcomes. This has now been established. So TAVI has been established as a very effective way of treating severe aortic stenosis. So certain patients will be put forward to that procedure, and they will then be seen by an appropriate specialist who either will replace the valve surgically, that will be a cardiac surgeon, or the valve will be put in by less invasive TAVI means, which will be done by appropriate interventional structural cardiologists.